in the future with the recorded version. I just wanted to make one quick comment. I think, I've been in the role for 5 months now, and obviously the one thing that's been constant is that every day it's new information comes and things change. And, we feel like we're at the center of this kind of hurricane of information around us, whether it's navigating the policies around COVID, the opportunities around that. And the one thing that I think has been true throughout all of that is that we have this amazing network of 750 plus members and thousands of nonprofits really in our state that can learn from each other. And that's really the power of the Idaho Nonprofit Center. It's the power of the National Council of Nonprofits. And David, who will speak here first in a second, has just been kind of a steadfast source of information and wisdom and knowledge, especially for me as I come in fairly new to this organization and navigating all of the policy questions that come out. So really grateful to have his information on this webinar, to have the latest and greatest from the federal regulations and what's happening at a national landscape, and then to have the wisdom of our partners at the Idaho Rescue Committee and the Boise office, and really getting some examples of how they've implemented and navigated this journey as an organization. And again, the power of learning from each other. We can take what works for each other and adapt in our own organizations, whether we're one person or 300. So with that, I'll turn it over to David. Again, as Ian said, he's the Vice President of Public Policy at the National Council of Nonprofits. And David, take it away.
Thank you, Kevin. I'm going to open my slides in just a minute, but first let me emphasize a point that Ian said of please submit questions or go on screen and shout them out or however you want to do it. I asked this for two reasons. One, it's always fun to stump the chump and see if you can throw out a question that'll make the speaker fumble and stutter and so forth. So that's just the entertainment side, but also we have the opportunity to get straight answers from the administration, whether it's the OSHA or the Centers for Medicare and Medicaid Services or the federal contracting folks. We can get straight answers. They are doing a terrible job, as they always do, in giving straight answers for nonprofits. Everyone assumes everything's a factory and that the rules that apply to factories apply to everyone else. They don't necessarily apply well to charitable nonprofits and the work we do. So your questions are vital because we've already submitted 8 to OSHA, and we can submit another 108 if we need to get straight answers so that we can apply this to nonprofits. This is an open invitation throughout this time, throughout the duration of the pandemic. Please do send questions. I'm going to suggest you go through Kevin and Ian instead of me directly because I kind of get lost in my emails. So with that, let me start the show, start my slides. You can see them, can you? Thumbs up. Okay, that's our topic, navigating the COVID vaccine and the regulations. Kevin mentioned the network of nonprofits in Idaho. Well, all of you who are members of the Idaho Center are members of the National Council of Nonprofits. We are a network of 25,000 nonprofits across the country. When Kevin and Ian come up with a really good idea, they share it with the rest of us, and we all expedite learning and get the word out that much faster because we've all learned together. Same happens if a good idea comes from North Carolina or Maine. You get it lickety split. And at the same time, if really bad ideas come up from around the country, anti-nonprofit stuff, we share on a regular basis. We have a call tomorrow, as a matter of fact, a public policy call where we all get together, and it's not a conspiracy. It's a collaboration of like-minded people out to make sure we promote the best, the public good and make it as easy as for nonprofits to operate as possible. So that's the value of the network. And we stay in touch and we engage on a regular basis. I'm going to quickly copy. I only have a little bit of time. I'm going to quickly cover 3 huge regulatory items. The OSHA rule, I already mentioned them. The OSHA rule, the CMS, or the Federal Contractor rule, and the Center for Medicare and Medicaid Service interim final rule. All of them touch nonprofits in a little bit different way. So I'm going to start with the biggie, the biggest one, the one that covers the most workplaces and has gotten the most attention. That's the OSHA Occupational Safety and Health Administration Emergency Temporary Standard came out in November or earlier this month. And the first question before we get into the details is it legal? It's held up right now by court decision, but we're hearing, is it legal? It's been questioned all along. This is actually what the statute says. The OSHA has the authority to issue emergency temporary standards when employees are exposed to grave danger of exposure, and the standard is necessary to protect employees from such danger. I mention this because if you read the emergency temporary standard, those words I've highlighted, I think, are in every paragraph. They went out of their way to say, yes, this is legal, we're relying on the statute and so forth. Federal court in the Fifth Circuit in Louisiana said nuts to that. The mandate, we kept calling it a mandate, a vaccination mandate. Kind of, the court was a little, had some blinders on in terms of going after this standard. It says it's a one size fits all sledgehammer, called it overbroad, over or under inclusive. But they had the authority, they stopped, blocked the emergency temporary standard from going into effect. All of us were supposed to be doing all employers with 100 or more employees were supposed to be doing a whole lot of paperwork by next Saturday, this coming Saturday. It's been stayed, and I'll talk about the timing of it. Is we don't expect the decision, or we don't expect a final decision on whether the stay will be lifted or made permanent for another week or so. The Fifth Circuit, somebody filed a lawsuit in every single circuit, federal circuit. I think there are 12 or 13. There are lawsuits there are more than 12 or 13 lawsuits spread out around the country. There's a system with the federal courts. They lumped all of them, threw all of them into a pot, and pulled the Sixth Circuit Court of Appeals out of the little basket, the lottery basket. Sixth Circuit won. That's the circuit east of you, Michigan to Ohio to Tennessee. They have all of the cases lumped into their one court. They're doing briefing and so forth, and we expect a decision from them in the next week or two or three, and then it'll go to the Supreme Court. And then it will go to the Supreme Court, will end just about every paragraph related to the vaccination on everything I'm talking about. But that's the status. It is on hold right now. So you don't need to take notes. You are going to get these slides, but we wanted to run through the requirements so that you know what's expected, and so that you can help shape your own decisions as what you want to do, what makes the most sense in your workplace. I'm going to go through the rule, who's covered, and so forth. So first off, the general rule, big asterisk, it's on hold right now, and it depends on what the courts say can happen. But the general rule is that nonprofit employers and all employers with 100 or more employees will be required to ensure their workers are vaccinated or regularly tested, with the exceptions for certain employees. That's a two-part, you have an option, vaccinate everyone or vaccinate some and require others to be tested regularly. This is a looser standard than the other two, so I wanted to just emphasize that point. Who's covered? I wanted to answer the obvious questions that you have when you first hear about it. All employees are counted. So full-time employees, part-time employees. If you're YMCA, the person who comes in and teaches one yoga class a month, that person is counted. Up to the number of 100, contract employees, independent contractors are not counted for this purpose. Once you reach 100 employees, you're covered. So if you have 13 employees working at your nonprofit summer camp right now in November, and come June, you have 120. Once you cross 100, you're covered. And then once you reach 100 and you go back to 12, you're still covered by this. That's the rule. Whether the standard lasts that long, it's currently set to be 6 months. So none of this may matter, or more likely OSHA will extend it if they ever get it started. If the courts let it go forward, it would likely be extended more than once because of variants and so forth. It's also clear that if you're an employer, if you're a nonprofit employer, and you're covered by all three of these rules, the most stringent rule, which would be the other two, would apply That's just good to know so that you can't pick and choose which law regulation you're covered by. Exclusions. This is important as your state legislature comes in and makes rules and so forth. I know they met a couple of weeks ago, and I'll come back to that. Medical necessity, and that's termed like medically contraindicated, a new word I learned. If you have a condition that the vaccination will make you sick, you don't have to take the vaccination. You're excluded from the requirement of getting vaccinated. Same with those with strongly held religious beliefs, practices, or observances. Those rules follow the determination is determined by rules of the Equal Employment Opportunity Commission. Link to those rules will be in the post-webinar email. It's important that even if an individual is excluded from the vaccination requirement, they still have to do regular testing. They still have to do masks, social distancing, things like that. Then there are exemptions. They're still counted to the 100, but they're exemptions, no requirement of vaccination or testing if someone works remotely or at home and works exclusively outdoors. That's probably not that big an exception or exemption, because if you're working on a Habitat for Humanity house, you're working outdoors until the roof's on. Then you're working indoors, so it's more of a timing issue. But it is something they spent a lot of ink explaining. What's required, once you know you're covered and once you know your employees are covered, what's required, you'll have to have a written vaccination policy, which sounds awful. The reason that OSHA said set the number at 100 employees is they determined, probably from just picking a number out of thin air, but they determined that an employer with 100 employees probably has an HR office, probably has someone who can do the paperwork for things like the vaccination policy. On their website, OSHA has a sample or a template vaccination policy and a template vaccination and testing policy. So you can go to their website, pick one or the other, tailor it to your own use, and that paperwork side is done. Probably tougher is that if the law is in effect or the rules are in effect and you have to be doing this stuff, you have to create a roster or proof of it of vaccination. So you have the list of all your employees, and then you go through and you see who is vaccinated, and there are rules about how you prove that. I won't go into the self versus counterfeit versus things like that. There are states that are trying to say you can't require proof or and so forth. Idaho is not one of them yet. Paid leave for vaccinations would be required. Assuming the rules go into effect, you would have to provide time off for an employee to go get vaccinated. And if there's an adverse reaction, flu-like symptoms for a day, like a lot of folks seem to have, you'd have to pay for that day. And then the testing of unvaccinated employees, people who refuse to get vaccinated or can't get vaccinated, it's the employer is not required to pay unless state law says so or their collective bargaining agreements. There are some states, I think 3 states recently announced or enacted provisions saying that the employer has to pay. Just an observation. Federal preemption is a key provision here. A lot of for-profit employers have quietly said, bring it on, because with federal preemption, it prevents the states from picking and choosing which rules they want to apply. And for a nationwide organization with lots of operations throughout the country, federal preemption is a popular thing. These are the actual words in the standard, in the statute or in the regulations. It's intended to preempt inconsistent state and local requirements relating to these issues, including requirements that ban or limit employers' authority to require vaccination, face covering, or testing, regardless of the number of employees. That's almost a laundry list of what the states have been doing. Any of you who receive the newsletter from my organization, Nonprofit Advocacy Updates, we ran an article yesterday, a long article, about how the different states are almost using this laundry list of banning vaccinations, special rules on face coverings, when you can test and things like that. So the states have been very active. And I realized was it 2 weeks ago, the Idaho legislature came in for special session. Our count, there were 36 different vaccination related bills, none passed except for a memorandum against mandates, and those may come back next year. You on the phone on the call may know more about that, but that's where that stands. That's the first one. I'll be quicker on the next two because they apply to fewer. First is the next one is the Federal Contractor Executive Order. A lot of folks say, well, I have the money we work under, we provide services under grants that came from the federal government. Uh-oh, it's a supply to us. Most likely not. Let me say that up front. The rule is the general rule there is that federal contractors must ensure their individuals working on or in connection with the contract. That's a key provision, or a contract-like instrument shall be fully vaccinated. You have to be vaccinated if you're working on the federal contract or so forth. There is not a testing opt-out. That's a key distinction. Now, which employees are covered? Let me talk about the term contract. The federal government determines that a contract is for services, goods or services provided directly to the federal government. So a case of copier paper that the federal government buys, they would use a contract for that. Providing services, hiring nonprofits to do services for daycare, after school, or other things like that. That is not a contract, that's a grant. Contracts are governed by the Federal Acquisition Regulation, the FAR, F-A-R. The written agreement you have will tell you if you are covered by the FAR, because it'll do cite chapter and verse from the Federal Acquisition Regulations. Contract-like instruments. I ask people in the White House, can you define that? And no, they can't. It's close. It looks like a contract. The most important thing is you probably have a grant with the federal government or with the state through using federal funds. Those are grants are governed by the OMB Uniform Guidance. Most of I think it's $600 billion in spending that flows through to nonprofits comes through grants, not contracts. So, and most importantly, your written agreement will say, doesn't matter if it's called a contract or a grant at the top of the page, the written agreement will cite the OMB Uniform Guidance. If that's the case, these rules do not apply. If it cites the Federal Acquisition Regulations, they do apply. The rule it was announced in early September. Some rules, some clarification came out September 24th. Most importantly, this is only prospective, meaning if none of this was in your written agreement on November 7th or 8th or 9th, or September 7th or 8th or 9th, the government has to scramble to get it in your written agreements. So it's only new and going forward agreements. Also, the government's going to let you know. They will have to reach out to you. So if you haven't heard from them, you're okay. Which employees are covered? Same through all three of these, the same two big item exemptions or exceptions apply. Accommodations for disability, including medical condition related to where the vaccination is contraindicated, and sincerely held religious beliefs, practices, or observances. And again, those are explained, and you as employers can work through those details using the EEOC guidance. What's required, the paperwork, things you have to do. I didn't do a lot of slides on that because it's in this document, the COVID-19 workplace safety guidance for federal contractors and subcontractors came out September 24th. There will be a link to it in your email if you do discover that your agreement is covered by the FAR and that this could apply to you. This one has not been challenged as far as I know. The first one has been blocked. And as I'm about to tell you, the second one, the third one, the CMS yesterday was blocked in 10 states. This one I think is still wide open. This is the government exercising its contracting power. It's the power of the purse, and it has more freedom to do this. It's the exact same law, constitutional and statutory law applies when the federal government recently mandated that all federal contractors must pay a $15 minimum wage. Does not apply to grantees, does apply to contractors. So it's the same law there. Now the CMS, what's required here? I presume you have a variety of folks on the call or watching who do some form of healthcare. The rule from the Centers of Medicare and Medicaid Services is that healthcare facilities that participate in Medicare and Medicaid programs must require full COVID vaccinations for all eligible employees, eligible staff. That word's key, eligible staff by in a couple of months. No testing opt-out. OSHA has vaccinate or testing opt-out. The other two do not. This one does not. It requires vaccinations. Which employers? There are 15 categories. I just listed 6 here. Clinics, home health care, hospitals, hospices. Long-term care facilities is an area where most of the data in the CMS rule, when they issued the interim final rule from CMS, they relied on data from long-term care facilities. And a judge struck down the rule yesterday. This is a judge in Missouri, and it applies to 10 states. Idaho is not one of those 10 states. So 50 states in the District of Columbia, the CMS rule does go into effect. Idaho is in the yes it does side, not the no it doesn't. But the judge focused on the fact that most of the data came from long-term care facilities, and it's a one size fits all. Not everyone else has the same closeness, same interactions. So the one size fits all approach he ruled was invalid. There are exclusions. I don't do healthcare, so I don't fully understand what I have on my page right here. But if it generally applies to those that have to follow the conditions of participation in Medicare and Medicaid. If you're not regulated by those protocols, those requirements, you're excluded if you only do one of those activities: assisted living, portable x-ray, and so forth. Again, I don't do healthcare, so I'm providing information that I don't necessarily understand. This page is one that I find most important. Which employees are covered? Facility employees, licensed practitioners. You'd think that healthcare facility, but it also extends to students, trainees, volunteers. Emphasize that. If I could have a neon light flashing, I would. Volunteers and contracted staff. Remember, I said that the OSHA rule does not apply to contracted independent contractors. We don't know if the OSHA rule applies to volunteers. We've asked that question. But this rule, if a candy striper or whatever they're called now comes to a hospital, that person has to be vaccinated. Anyone who's a trainee or a student, so the med students coming through, have to be vaccinated. Those are a very big deal because that's a lot of extra people that you have to keep, that the employers will have to keep track of. Remote work, it does apply to employees who are working outside of a hospital or hospice or something that go to a home, that people who are doing healthcare services in homes or in person. Full-time telework staff, like I am most of the time these days, and perhaps like most of you, full-time telework staff are excluded, don't have to be vaccinated. There are exemptions: medical condition, the religious beliefs. There is no exemption. Here it's expressly stated there is no exemption for COVID-19 antibodies. You remember a football player who just blanked on his name, who was saying that he was immune, he was fine because he had already had it, he had antibodies. Does not apply. The state of Florida just made that exception statutorily valid. But this says they're not buying it. You have to be vaccinated. You can't just claim that you have the antibodies because you had COVID before. Testing and other requirements are allowed. I'm not sure what I meant there. But enforcement is rather rigorous. There's state survey agencies as an existing enforcement structure. They do their recertification surveys and the compliance surveys. So they're going to have the states, they're going to stick the states on you, have them enforce this. There are criteria. You have to have all employees vaccinated, providing exemptions, acknowledging the exemptions and accommodations, and then tracking and documenting staff vaccinations. That's a hard part. Penalties can be monetary and so forth. That's the end of my slides. And I'm not sure, Ian, Kevin, if we want to go straight to Julianne and Georgette or want to do questions. I'm good either way.
We can open the floor for questions. If anybody has any questions, feel free to chime in. Looks like we've got a comment from Phil here in the chat. and I'm happy to read this out. Like most nonprofits in Idaho, we are very small, currently 5 staff. Perhaps you will cover this, but I am mostly interested in this. Can we require tax or tax/testing as a condition of employment, both for current employees as well as those we might hire? I'm about to
I think
announce
that
a
means
job.
vax. Spell check corrected, vax tax. Can you require it? It's state law. Generally, the answer is yes. I don't practice law in Idaho. This is not legal advice, but Idaho is a right to work and a employment at will state. And employers have the freedom to require vaccinations. And a lot of organizations are watching these rules or using these rules, even if they don't apply to them. The 100 employee, they're still following the rules because there has been a lot of thought that's gone into how to work it out, accommodations and things like that. So most employers that I'm seeing and hearing from are adopting the rules, even if they're not applicable to them because of size or the courts have blocked them and so forth. They have stepped up and are applying some form of rules. I know many nonprofits in the Washington, D.C. area did mandate vaccinations long before, I guess very early this year. The reason being they work directly with employees. I know a prevention of blindness organization does glaucoma screening. Those are usually older people, and to do a glaucoma screening, you're this close to the eyes of the other person. So they take the work they do, the mission they're pursuing, and then make the determination. So there are the regulations themselves are many are using as kind of a cheat sheet for best practices. A lot of folks as we all know, there are many employees who do not want to get vaccinated, and many employers who do not want to require vaccinations. It is your responsibility and opportunity to run your business, to run your organization, to advance your mission in the best way to keeping people safe. And so a lot of employers are adopting vaccination requirements.
All right, thank you. Does anybody else have any other questions for David? We have a comment here from Georgette.
You want to share it?
Yeah, Georgette, if you want to go ahead and speak.
Oh, sure. Yeah, just, adding on to the end of your question there. I mean, I think it's great for, everyone to know what they're applying for. So I always think that the more details you can include in the job descriptions is best. Although, as I'm saying this, I'm not quite sure if we have that in our job descriptions.
We do.
Oh, okay, perfect. That's great. Yeah, so I think that's always helpful to just be upfront and as clear as possible. And then in interviews, I just, let them know that we have this policy, and then ask if they have questions and concerns. And typically people will just say, oh, I'm already vaccinated, so that's not a problem for me, or they might have additional questions, but it's just an easier way than flat out asking someone, so are you vaccinated?
We have another comment from Phil here. It says, from a hiring view, I'd agree, as public-facing policy in North Idaho where anti-vax is strong could create controversy. Yeah, again, I think having transparency up front is very important. If anybody has any further questions, feel free to put them in the chat. Otherwise, if you think of one at a later time, shoot me an email and we can follow up with David. Again, like David stated, we're going to send out the recording of this along with the slides and the links that he mentioned in the presentation. And if you have any questions around those, we're happy to support you and clarify what those mean. So yeah, big round of applause. Thank you, David. That was awesome. With that, I'd like to pass it off to Georgette and Julianne with the International Rescue Committee. Julianne and Georgette are both going to speak about how they implemented this policy within their organization and how this was designed. So with that, I'll pass it along to you two.
All right. Well, the benefit of a small and awesome audience is being able to really tailor to what you guys want. So I'm going to offer up my hope and expectation of this time. But as David shared a minute ago, really invite everyone in with questions. We can certainly redirect away from our planned presentation to focus on what you really would like to hear as needed. Basically, IRC implemented a vaccine policy that wasn't caused or directed by the OSHA rules or other rules. It's something that comes very much from our internal response to a pandemic. And we're very excited to say, here's what we did, here's how we did it. We're not offering it up with an expectation of this is a better approach than anyone else's approach. We're not offering it up with the intent to coerce anybody into taking an action that they disagree with or follow a policy that they disagree with. We just want to show, here's what we did, how we did it, and what we learned. And if what we learned can be helpful in your organization, we would be very happy for you to take it in the direction you please. We prepared a Mentimeter just to take a little bit of a pulse of the audience. We could also just ask folks to share verbally or in the chat as well. So any medium, whichever one you're most comfortable with. And the questions from the Menti are your own temperature check on COVID vaccine policies, including COVID vaccine requirements in your workplace, and if there are any COVID safety practices in place. I visited a sister nonprofit a couple of months ago, and I was really surprised to see that they weren't masking, social distancing, or doing any of the things that are fairly strictly a part of our work culture. So I know that there's a lot of different work cultures around our sector and around our state. So anybody want to hop in or write in the Menti?
For those of you looking for the link, Georgetta's posted that in the chat. And if you click on that, that will take you over to the question.
I think I'm just going to call out, Phil, from your comment, there's internal culture and then there's external culture, right? To what extent an internal policy might create landscape risk outside of the organization. That's also an important consideration, right?
Yeah, I'm happy to speak with that if that was an invite. And our board of about 6 people and staff of 5 are all vaccinated, but that's because of a common culture, an internal culture, not a set policy. Though with the opportunity to hire someone new, that's spurring the need to establish policy. We do a number of events in the community, and in our community, the vaccination rate's not that high. So we have, over the course of time, adapted and adjusted those events to the realities, offering some virtually, offering some with social distancing requests or requirements, scaling back in size and holding them outdoors. As we're entering into the winter, this too is going to become an area that we're going to need to address. Some of the venues we hold them at have more stringent guidelines, and so to some degree we are sidestepping the need to create our own policy by conforming to those of venues which have policies that adhere more to our internal thinking. But I'm not sure how long that goes on effectively.
All right, thank you, Phil. Appreciate it. Thank you, Monique, and everyone who's put input into the temperature check. So I think, there we go. And the next question is, do you provide in-person services? So IRC, what we do is inextricably connected to being in person. We pick people up from the airport, we set them up in new housing, we're driving people back and forth to hospital, classes, appointments. We're often visiting and providing tutorials in person. So very strongly in person with the vulnerable population. Awesome. So lots of in person, not necessarily with vulnerable groups. Okay. All right, would you mind putting up the slides, Georgia? Thanks. All right, so something that's super important to us in all of our design work is really building around our clients. This photo is from a family that is greeting another family that they've been separated from for years as they're coming through the doors of the airport. So their loved ones are just walking towards them. If we could go ahead. As a culture, our organization globally also has quite a lot of experience in responding to disease-based threats. We have run Ebola clinics in different countries and stood up pretty quickly in response to COVID, a health team that was informed by both emergency response and Ebola response in prior iterations. Something that was really a point of pride for me being a member of this organization is that we were attached to a pretty robust health unit that was doing a lot of data gathering, a lot of information that they were feeding to us from the very beginning, as well as messaging that we pumped out within the first few weeks of the pandemic, translated into up to 12 languages, text, videos, audio recordings. We really thought that being ahead of this and helping our constituencies really understand was super important. Thank you. We did assess from pretty early on, there's no such thing as zero risk. And we started off with a very cautious approach, right? Basically, knowing that there's no such thing as zero risk, we implemented a wide array of mitigation practices that we haven't lifted. So while other organizations have kind of gone up and down as to whether masks are required, how stringently cleaning and hand sanitizing protocols are required, IRC has not vacillated. We have learned that the complexity of managing mitigations does need to be manageable for the human brain. So if you could go ahead. One more, please. Thanks. When we started, we'd planned out, here's the whole set of curves that are likely in a pandemic. And you can see the columns below, we had a different set of responses for each curve. And as you can imagine, as you know, we've all gone up and down iteratively, and it became pretty confusing and too multi-layered to try and have an entirely different set of policies. If you're on the downward curve about the same height, or if you're further down the downward curve, or if you're a little bit up the upward curve, that just became too, just way too complex. So one more. Instead, we've now got an on-off switch that basically says we're either surging or stable, and you have a set of policies that attaches if you're surging or stable. And for all of the cities that IRC operates within, we're all surging, right? So we're pretty comfortably within, this is the set of policies that you're going to be in. And if you wouldn't mind jumping back to, that would be awesome. Sorry about that. So these are the 10 core mitigation measures that we have that we're sticking to religiously. Even looking at this with an on-off switch of stable surging, it seems pretty clear that having one set of policies for people that are vaccinated and another set of policies for people that are unvaccinated is still pretty complex. And knowing that there are high in-person contacts, a lot of work with communities that are vulnerable, it didn't seem to make sense for the good of our clients and for the good of our staffs to not require the vaccine. So we did come to a decision internally that was cascaded from our leadership to everyone in the field. We didn't have the greatest cadence or delivery transmission of the policy. And I think that's a learning point that I would offer out to other organizations hearing this information. What kind of pain points could be avoided if you have a slower and more gradual runway up to the implementation date than a fairly abrupt implementation date, which is what we had. I'm going to skip forward again. Thanks. Veering from the text on the slide a little bit, one thing that was extraordinarily helpful in bringing our staff alongside is the fact that we had been doing community education with staff on COVID from the very beginning. Georgette's going to talk about that more at length, but because we had involved so many different voices in the thinking around the communications that we're doing and getting them involved in recording our messages and building the information and trust from that point, I think that made the issuance of our policy a lot more acceptable than it could have been. Go ahead. All right, so our vaccine policy, fairly similar to what David laid out earlier in the call, is that all staff, all volunteers, anyone who could come in contact with a client must be vaccinated. It's a contingent portion of our employment. There are a couple of carve-outs. The carve-outs are if someone has a valid medical excuse and a valid religious excuse. Those reviews are actually not handled by our local team. They're reviewed by our central HR and central legal teams. So if there's someone that identifies or wants to go through that pathway, we help match them with the folks who will accompany that pathway, but we don't locally accompany them on that. We have one other pathway out, which is to say, if a person's entire job function can be accomplished remotely and does not put a huge burden on the rest of their team to be able to accomplish that job function, then they may complete it. As you can imagine, doing direct services, as I've described, it's mostly field work. So it has been exceedingly rare to see in our network someone whose job really could be done fully remotely. We have seen very little use of that prong, therefore. And I think, Georgette, I will turn it over to you to talk a little bit about the education that we did to community that rolled through staff.
Yeah, thank you so much, Julianne. Yeah, so really early on in the pandemic, as Julianne shared, we, just like everyone else, we're trying to figure everything out. A lot of the people, the communities we work with, English is not their first language, and some people are still learning English, or many people are. So one thing that was really important to us right away was to get language accessible information so that people would be able to protect themselves and their families. Again, right when everything was starting out, there was a lot of information to learn, a lot of information to try to share out. And along with that, we did a lot of listening as well, right from the start. I think if I go here, we kind of started just doing translated flyers, and this is what we had been doing for a long time, kind of printing out flyers, hanging them up on the walls, mailing them out to the people who were receiving our services. But through those town halls and through those communications that we had with, various communities, we were informed that they weren't very useful. First of all, that not a lot of people really were opening them, and that's not where a lot of people were getting their information from the mail. So people told us that, one, community leaders wanted to be involved and they wanted to be able to share messages out themselves to the community. Two, when we had information to share out, instead of doing flyers, that we should have audio or video recorded messages that could, instead of on Facebook or really anywhere else, really just be sent out through WhatsApp. That's really where most of the communities that we're serving are communicating, getting their information. And so I've been really proud of our COVID work from the beginning. Of course, there have been very many landscape changes and everything that we've been trying to navigate. But everything that we've done, we've really kept the community at the center, really, with the thought that we are here to protect or to make sure that people can have the information accessible to them and then make the decision for themselves what they wanted to do with that information. A couple of core factors that have been really important in our work: community centering, again, non-judgmental attitudes, conversations, not lectures, respect for differing viewpoints and facts from trusted sources. So again, we've had a lot of focus on two-way communication, and this video, or this little screenshot of a video you hear on the side, that's from one of IRC's interpreters, or that they were an interpreter at the time. Now they have a different role on our staff, but sharing an update about, I think at this time it was a mask mandate that was issued, the first one at the time. So it's from quite some time ago, but having that recognizable face and having the ability to send it out to leaders in the community who would then send it out to the people that they talk to a lot was very, very helpful. And as Julianne mentioned before, a lot of this work in centering voices and listening and conversations rather than lectures also helped our staff and our staff response when it came time to announce the vaccine policy on our staff. And I think already there was a pretty strong culture of a lot of people had gotten vaccines. And just to say, this was something that worked really well for us. And I think, regardless of what the policy is going to be on your team, I think this approach of listening, non-judgmental, and, sharing, facts, here's a policy, and then, going from there and walking with each person on your team rather than just kind of telling what to do is very helpful. Julianne, I'll pass it back to you.
Sure. So we had fairly little notice from when there was a all staff email that came out saying, here's the new policy, and now go back to your teams and discuss it. And I must admit that I approached this conversation with a fair amount of fear. What are folks going to say? Are we going to lose a decent percentage of our team? We have, really incredible folks, as do all the nonprofits that are in the sector in Idaho. I was really kind of shocked and surprised. I set up a moment in the all staff where I just said, who wants to comment both about the policy and about their own vaccination experience? And we had several voices step in. And I think, Georgette, we're going to play an audio clip of that.
Just a second here. All right, let me know if this sounds okay for everybody.
I'm not hearing any.
You're not hearing anything? Oh, I'm so sorry about that. All right, let's try that one more time.
Yeah, and I can go next. I'm actually not fully vaccinated, but I've taken my second shot, and I've taken the first one, and then I'm getting the second one on Friday, just because I was told you usually experience symptoms, and I'd rather those symptoms go into the weekend than the work week. I actually went with my mom. She has a really weak immune system. She doesn't have a spleen, and if you know that your spleen is what protects you from like a lot of diseases, so if she were to get it, my family already had COVID earlier this year, and it was so bad. Like, I think I was bedridden for like 4 days, and so was she and my siblings. And after that, hearing about the Delta variant and all that, it's so scary. I'm like, oh my gosh, I don't want this. Also, I just want to go out a little bit more. I'm like always home, and I'd like to spend some time outside, and I was really scared. I didn't want that. And also, I don't know if you, the African community, most of them, I'm like so skeptical about getting the vaccine. So especially since I was doing COVID education, they'd ask me, oh, have you gotten the vaccine? Why not? So I'm like, okay, I will take it. I even took a video and shared it with people around the community so they can see that I got it and I'm fine, and encourage others to get it.
Thanks. And Julian, do we have time to play the second clip, or would you like to continue at this point?
Yes, question to the audience. Any preferences?
I think we have the time. I'd love to hear the second clip if you guys are willing to play it.
Sure. All right.
I really, really appreciate you guys sharing. Thank you. Anyone else?
Hello there. So if it's okay, I'll share my experience as well. I came and got the vaccine back in mid June, I think, when I came back for kind of a vacation, and also when I applied to this job at that time. The reason why I got it was because in Kurdistan, north of Iraq, it was very difficult to acquire an appointment for the vaccine because they were very limited. And then when I went back, some of our staff over there didn't have a chance to get the vaccine. They were on the wait list, and they would, and then I would, because I got so into Boise and the local news and everything. I remember at that time there was a $100 gift card from Winco that they gave you with getting the vaccine, and I was telling them about it, and they said, look at what that American American loveliness. They're even giving you a financial relief on top of that just to get the vaccine, and we can't even get it. So I really recommend people to take some time and take a look at the opportunity that you guys have, that everybody has here in United States and in Boise, and know that not everybody gets that chance. So, but I after taking it, I feel very good, and there's it's kind of nice to have that little bit of confidence for yourself. But even though this variant, and the only reason why this variant is coming is because the country itself is slow to take these vaccines. So, but anyway, that's my little thing.
All right, and I'm going to go ahead and stop sharing my screen here. Again, this we had several other staff members who were willing to share, similar to Georgette and Hakeem, who you just heard. And again, we think that this is largely because we had that culture of, sharing and listening. So we were really proud of that moment. And as Julianne mentioned, it was kind of scary going into that meeting, but I think we were really happy with the outcome. I do want to take just a quick minute to share, an experience, just my experience, I guess, as a team member and a manager. I think I found out about the policy just a couple days before we announced it to all staff as a manager. And again, it was really abrupt. And even with our culture, as you could see, we had a lot of data, we had a lot of, just everything about the vaccine embedded in our organization-wide culture, and it was still really abrupt. So I would say, let your employees know. I think if you're thinking about having one, and again, I think being clear is really helpful, but, kind of have some conversations leading up to it, or at least have some time in between the announcement and the implementation. And I would say probably like a month or even 6 weeks is a good amount of time for that. As again, it was abrupt for me, and even, as someone who had already taken the vaccine and everything. So that's definitely one huge thing. And again, the principles that we talked about before for community listening, we also took and I really tried to include them in our team conversations. Most of my team was already vaccinated, but I did have to have, some conversations where, it was listening, non-judgmental, and, just kind of slow and kind of letting them take the lead and facilitating those conversations over some time. Julianne, I'll hand it back to you for any closing statements.
I think we've got a couple minutes left. If there's any questions, things that you think about, like what would this feel like in your organization? How did you handle this or that? Totally open to hearing them.
Can I ask, did employees ask to have their job duties changed so that they could avoid a vaccine?
We did have everybody, not everybody, we had a couple of people look at their duties and say, could this be done 100% remote? And there's a small sliver of our organization that could be, but most of the things in our organization require field work. So it was, by and large, everyone needs it.
Not hearing other questions, let me ask mine. An issue I mentioned on the CMS rule is that prior having the antibodies in you because you had COVID before, or you think you have those antibodies, is that something that is a hot topic in Idaho, or are others hearing about that as an alternative? Because that seems to be a growing political solution. Not a scientific, but a political solution. Are you hearing, either did you hear it in Julianne in your organization, or are others hearing that as an alternative?
I would say we had done so much talking about levels of risk in terms of, if you're vaccinated, you could still be a carrier, so you got to keep your mask on. So there wasn't any of that in our conversation, but perhaps because we had been talking about how risk stretches through whether you've had it, whether you've had vaccine. I don't know, Georgette, if you would layer anything else in there.
I agree.
So we require for in-person classes, our student, staff, and volunteer tutors to be vaccinated. We do have a virtual option for if anybody does not want to do that. So, but we did have an in-person tutor who said that he had COVID and had the antibodies, and we did not accept that and said we would still require the vaccine, or he could be a tutor virtually. So, and that's what he wound up doing, because it seemed like to me a rabbit hole to go down. How would I know that? How would we even prove that? We were requiring, we still require for new students in person and tutors to see their cards. I didn't know how we would even prove that. What if everyone started saying, I have the antibodies, so I don't need a vaccine? And it's already so difficult. I mean, it's everything we're talking about here is just, it took a lot to come up with the decision to require these things. And I just didn't want to make so many more exceptions. So we have had that, but just one out of 250 tutors. So
we are seeing it around the country. I see where our timer's running out. My son in Chicago had COVID, flat out COVID, as did his girlfriend, who was a nurse in that intensive care and so forth. He had 0 antibodies, so he's been vaccinated and so forth. So having had COVID does not mean you have the antibodies. So Monique, I agree with you wholeheartedly. How would you know?
I would say just one comment. I know we're wrapping up, but last thing, we had some staff that were concerned that we would be saving personal medical records. And we didn't save or store. We had all supervisors visually checked the cards once, but did not save a copy. There's no archive that we're going to go back to and look up. It's just an experience that happens and is not archived.
Great. Well, thanks again, everybody, for taking time out of your day. Thank you to our presenters, Georgette, David, Julianne. This has been super informative, very helpful. If anybody has any further questions, feel free to send me an email at my email address that is in the chat. I will follow up with a recording of this webinar, as well as links and also links to the slides. Yeah, thanks again, everybody. We hope you found this to be informative, and we hope to see you at future Idaho Nonprofit Center events.
Thanks for
Thank
having us.
you.
Thanks,
Thank you so
everybody.
much.